I am Alex Martins, and it's the first time I am doing this kind of things here from my office at the university where I work, Marquette University. And I'm here just to say a few words about my new book that is my first book in English. I had read 5 books, but all of them was published in my first language, that is Portuguese. And now I published my first book in English, and I just want to give you a very short introduction of this work. So here is the book, The Cry of the Poor, Liberation, Ethics, and Justice in Healthcare. So this book is a result of many years of studies, research, and work on healthcare within impoverished communities around the world. Mainly, I bring here the voices of the poor to the academic and socio-political debate on healthcare. And I bring the voices of the poor from my work in Brazil, Bolivia, Haiti, and Africa. So this book starts with justification why the voice of the poor have something to say in healthcare, what the contribution for that. That's the first aspect of the book. Is a very the first chapter is very complex because it's a epistemological chapter, and then we go to the first part of the book that is more theoretical, in which I develop theoretical fundamentation for healthcare as a human right from anthropology of suffering. And that anthropology of suffering is built on the thought of a French philosopher named Simone Weil and on the liberation theology tradition from Latin America, especially from the principle, the preferential option for the poor. The second part is more experiential because that shows exactly the voice of the poor, in which I bring the voices, the experience, that knowledge to the healthcare debate. If you read that part, it's easy to read because you see a lot of people speaking about their healthcare issues and what they see they can do to improve their healthcare in the reality where they are. This part is more like anthropological, with based in ethnographic analysis and dialogue with the communities, impoverished communities, including indigenous community in south part of Bolivia. And then the last part is practical. I develop in the last part method of healthcare delivery in global health and healthcare advocacy for healthcare as a human right in a process that I call a process of mutual learning. I am inspired in authors such as Simone Weil, that I said before, but also in Brazilian philosopher named Paulo Freire in his liberating education method. So I inspired that thought, I developed a healthcare delivery method in global health, in which include the participation of the poor as active agents of healthcare delivery and healthcare promotion. So that way, health professionals and others join to the poor, and together they work to promote global health. So here is the suggestion, the book. I just want to finish with a word about the cover. The cover was made by a friend of mine who is an artist from Brazil, Sergio, and he did that inspired in the book. He read a summary of the book because he couldn't read English, and then he did that art inspiring the book that is in the cover. So thank you, Sergio, for that, and I hope all of you had opportunity to read the book and engage in dialogue with me and the board. Thank you.